Treating lab numbers, not patients. A cautionary tale for doctors and clinical pharmacists. In the fast-paced world of modern medicine, where technology and data drive many clinical decisions, it's easy to fall into the trap of treating lab numbers rather than patients. Lab results are invaluable tools for doctors and clinical pharmacists, providing essential insights into a patient's health. However, when we prioritize these numbers over the individual sitting before us, we risk losing sight of the holistic approach to patient care at medicine's heart. The rise of lab-centric medicine. Advancements in diagnostics have brought an array of sophisticated lab tests that give detailed snapshots of a patient's physiological status. Blood work, electrolyte panels, liver function tests, and other biomarkers provide objective health measures. These data points are crucial for making informed clinical decisions, but they are just that, data points. Many healthcare professionals have become increasingly reliant on these numbers, sometimes at the expense of patient interaction. Instead of listening to the patient's symptoms or concerns, clinical discussions often shift to a series of metrics: creatinine levels, HbA1c, LDL cholesterol, etc. While these values offer important insights, they don't capture the complete story. The danger of tunnel vision lab results are like pieces of a puzzle. It's impossible to truly understand what the patient is experiencing without the full picture. By focusing solely on lab values, clinicians may miss critical contextual factors such as lifestyle, psychosocial stressors, and even subtle symptoms that can indicate underlying issues. For example, consider the patient whose blood pressure or glucose levels appear well controlled on paper, but may still feel unwell or report unexplained fatigue. Dismissing these concerns because the numbers look good can lead to misdiagnoses or poor management of chronic conditions. A clinical scenario 1. A patient's potassium level is mildly elevated. The clinical pharmacist flags it for immediate correction while the physician orders a treatment protocol to lower the potassium. However, they overlook the fact that the patient is on an unnecessary supplement that's driving this abnormality. The true solution? Simply discontinuing the supplement and monitoring rather than aggressive interventions. In this case, treating the lab value instead of assessing the root cause led to unnecessary interventions. A clinical scenario 2. Imagine a 67-year-old female patient with a fever, fatigue, and a productive cough for 3 days. Her physical examination reveals coarse crackles in the lower lung fields, suggesting possible pneumonia. However, her initial C-reactive protein, CRP level, a marker commonly used to assess inflammation and infection, comes back low, well within the normal range. The clinical team, reassured by the low CRP, decides not to start antibiotics, assuming the symptoms are likely viral or non-infectious. The patient is sent home with instructions for symptomatic relief and a follow-up in a week. Within 2 days, the patient's condition deteriorates rapidly. She experiences shortness of breath and a high fever and is readmitted to the hospital with sepsis symptoms. Tests reveal elevated CRP levels, and chest imaging indicates bacterial pneumonia with complications. Antibiotics are administered, but her recovery necessitates intensive care and ventilation. What went wrong? The clinical team's reliance on the low initial CRP led them to downplay the possibility of an infection. However, CRP levels can sometimes lag in response to certain infections, particularly in elderly patients or those with atypical presentations. In this scenario, the patient's clinical signs, fever, cough, and lung findings, should have prompted treatment despite the low CRP. The delay in antibiotic therapy resulted in a preventable deterioration of the patient's condition. This scenario underscores the danger of over-relying on lab numbers like CRP to make treatment decisions. Infections can evolve rapidly, and biomarkers may not always provide a complete picture in the early stages. Had the clinicians treated the patient based on her clinical presentation rather than the initial lab result, her infection might have been controlled before reaching a critical stage. Treat the patient, not just the numbers. The key to successful patient care is balancing objective data with subjective experience. This means interpreting lab results in the context of the patient's history, symptoms, and overall clinical picture. The adage, treat the patient, not the lab result, still holds today. Here's how we can realign our practice to focus on the patient. 1. Contextualize lab results. Lab values should always be interpreted in the broader context of a patient's clinical presentation. Is an elevated white blood cell count due to an infection or something less urgent, like physical stress? Are slightly abnormal cholesterol levels a reason for immediate intervention, or should lifestyle changes be prioritized? 2. Engage with the patient. A 10-minute conversation with the patient can often provide more insight than lab tests. Listen carefully to their symptoms, concerns, and lifestyle habits to understand deviations in lab results. 3. Collaborative decision-making. Decisions should be patient-centered, especially for clinical pharmacists involved in medication management. Collaborate with patients and physicians to adjust medications, focusing on lab results and how patients respond physically and emotionally. 4. Reevaluate normal. What is considered normal in lab values can vary depending on individual factors such as age, race, and even genetics. A number slightly outside the reference range may not always indicate pathology. Personalizing care means adjusting our perspective of these normals. 5. Follow the clinical pathway. Lab results may guide treatment, but they should not dictate it entirely. A high or low result should lead to further investigation, not just immediate correction. In the absence of symptoms, a wait-and-see approach may sometimes be appropriate. Conclusion: a balanced approach. Doctors and clinical pharmacists must resist the temptation to make lab numbers the primary focus of care. While these numbers are powerful tools, they are not the sole determinant of health. Patients are more than a collection of test results. They are complex individuals with unique experiences and needs. As healthcare providers, we need to restore balance by treating both the data and the individual, ensuring that a holistic patient understanding informs our decisions. After all, medicine is not just science, it's also an art, a delicate balance between what we know and who we serve. By staying grounded in patient-centered care, we can ensure we don't lose sight of the person behind the numbers.